My name is Carl Pearson, and this will take a little bit longer than usual, but there is a way of controlling the virus, and I want you to learn what it is. I've just done the research, and I'll explain in this video. I'm an attorney for many years. I went to Harvard Law School. I'm a high school dropout with no diploma, but I did graduate with a BA in 2.5 years, magna cum laude. I've been a small business person since my paper route in Nebraska at age 9, and I'm witnessing the rapid destruction of my 52-year-old law practice. I'm almost 84 years old and cooped up in the heart of the coronavirus for the past 72 years in an effort to live many more years. That is my story, and I now have the time to figure out why South Korea has no new cases of the coronavirus, whereas the U.S. has more than 20,000 new cases each day and increasing. Maybe there is something I can find or figure out which accounts for this deadly difference. The following event precipitated South Korea's president and ministries to act decisively and to world acclaim. On February 16 this year, a 61-year-old woman with a fever entered a Church of Jesus in Daegu, South Korea, and sat with approximately 1,000 other worshippers and left behind a trail of pathogens leading to thousands of infections, one of the largest coronavirus outbreaks in the entire world. New confirmed cases were doubling every few days, and pharmacies were running out of face masks. A dozen or more countries imposed travel restrictions, including the U.S., which at that time had only a handful of deaths. In 1 month, South Korea stopped the virus in its tracks. The government demanded the church's membership list. Thousands of worshippers. All were ordered to self-isolate. Within days, thousands of people in Daegu were tested for the virus. The most serious cases were sent to hospitals, and milder cases checked into isolation units at various corporate training buildings. The government used a combination of interviews and cell phone surveillance and credit cards to track down the recent contacts of new patients and ordered those contacts to self-isolate as well. So here are the factors, really in no particular order, that I think are relevant in understanding why South Korea licked the virus by May 6, 2020, with no new cases for 3 days in a row. And we in the United States are only starting out and will probably have to wait until Inauguration Day in 2021 before any meaningful national action is even begun. 1. The population of South Korea is about 51.5 million. That's 1/6 of the United States population. So even though it's smaller, it's somewhat comparable. It's a huge place. The government has 3 branches: legislative, judicial, and executive, and a careful system of checks and balances is in place, unlike our country. 3. On January 27, 2020, after 4 confirmed cases, South Korean health officials met with medical companies, and 1 week later, the first test kit was approved. But in the U.S., in early February, a CDC-developed test kit was approved by the FDA, but proved unreliable. Without testing, the U.S. did not know how widespread the virus was in our country, and failed to do anything about buying reliable test kits from other countries, such as South Korea and Germany. 4. South Korea set up drive-in testing facilities for those wanting testing. The U.S. did not, partly because local government had no funds and had no test kits, and because there was no order and funds for this from the federal government. 5. South Korea closed its schools while we left them open much longer, and are now opening them up before the pandemic is resolved, unlike what South Korea did. 6. South Korea was testing before it even realized that community spread was occurring. They used widespread testing along with follow-up of all persons testing positive, and thus were able to find infections and control widespread transmission of the virus. 7. Broadband internet speeds in the United States are only about 1/4 as fast as those in South Korea, the world leader, and U.S. internet connections are 33% more expensive, which means broadband is effectively 6 times more expensive in the U.S. because of the lack of enforcement of the antitrust laws. That's another reason. Fast broadband and its widespread availability enabled South Korea to better inform its population about the pandemic and instruct them what to do, and with a national authority and by professionals, unlike the variable public performances and everything will be okay notices by the U.S. President. 8. Today, South Korea offers world-class health care to both its own citizens and visitors alike. The South Korean healthcare system is run by the Ministry of Health and Welfare and is free to all at the point of delivery. The system is funded by a compulsory national health insurance scheme that covers 97% of the population. The U.S., through a variety of decisions, has not encouraged a substantial percentage of the population to seek testing even when showing coronavirus symptoms, such as immigration problems, can't afford testing costs, can't afford to lose a day's pay, or it's all a hoax by the president and some of the major media. 9. The unemployment rate in South Korea in 2019 was 4.8%, and that's comparatively low compared to most of the 34 OECD countries, that is the 34 democratic countries that support free market economies throughout the world, and has a relatively high standard of living, but it is lower than the U.S. except for home rental costs. 10. Moon Jae-in, age 67, is a South Korean politician and human rights lawyer serving as president since 2017, just 1 year after President Trump got into office, or was elected. So they're both serving from the same year, actually, 2017. Before this, he served as chief of staff to the then President Roh Moo-hyun. That was in 2007-2008, and Moon was the leader of the Democratic Party of Korea, 2015 and 2016, and a member of the 19th National Assembly. He was born to North Korean refugees and raised in poverty in Busan, an important seaport in Asia located at the southern tip of the Korean peninsula. Moon was a longtime friend of Liberal President Roh Moo-hyun and was chosen to be Roh's campaign manager in Roh's successful 2002 presidential bid, and Moon served in Roh's administration in various official capacities. 11. Moon's response to the COVID-19 pandemic has received praise domestically and internationally, and helped his party win an historic victory in the 2020 legislative election. 12. President Trump, on the other hand, has a different background in most material respects. Age 73, born rich, lived with wealthy parents, yes, in the seacoast city of New York, and has no experience in any political jobs or activities until he ran for the presidency in 2016, and never helped to run an organization having more than an estimated 10 employees, and has a dubious educational and employment background, and may have difficulty reading due to a possible dyslexia. 13. South Korea, in its race from the economic bottom at the end of the Korean War, focused on its economy and is now challenging France as to standard of living, but is still behind the U.S. at least prior to the pandemic. South Korea's people work longer hours than Americans and are more used to enduring hardship as a result of their efforts in overcoming the effects of the Korean War. 14. South Korea is high-tech, and residents have and use credit cards and cell telephones, which enable South Korea to locate where the coronavirus carriers had been and who had been there at the same time, and help to locate the thousands of parishioners who were at the church in February and were infected. 15. South Korea had its first coronavirus case on January 20, 2020, the same day that the U.S. in Seattle, Washington, had its first coronavirus case. Still, it was January 19, 2020 in Seattle. The first case should be the starting point for my comparison, especially when the starting point is the same for both countries. 16. Both countries are democracies governed by a constitution, and both are divided into states, counties, cities, and smaller as to the U.S., and administrative divisions, cities, and smaller as to South Korea, which has, as I've said, 1/6 of the U.S. population. 17. The President is the chief executive of both countries, and they are elected by popular vote. 19. Both presidents are ruling with little effective opposition. So what the president wants in a national emergency, he is probably going to get. The South Korean president got what he wanted, and the U.S. president didn't want anything. 20. South Korea's government has many ministers of government agencies that are filled with career employees, so that it is difficult to obtain government employment because of the lack of openings. In the U.S., however, the current administration has reduced government operations through directions not to function by firing career employees and not replacing employees when positions open up, and by not taking the expert advice of the employees who are still working. 21. South Korea has trained employees available to contain the virus and were allowed to use their professional judgment, whereas in the U.S. the employees were fewer than needed, demoralized, and not able to function because of the need to have approval from the top, which was not forthcoming. 22. The President of South Korea permitted and encouraged its ministries to develop and implement solutions on a national basis, whereas the U.S. President did not permit or encourage his agencies to contain the coronavirus for reasons not totally understood, but may be that the President did not want testing to reveal the number of cases, that the number of cases was thought to be a factor against re-election, that ignorance of the way in which a deadly virus could spread was not understood by the President, and that he decided to go for re-election and thereafter deal with the coronavirus. 23. Once the coronavirus got out of control, instead of belatedly using the powers of the nation to bring the virus under control months after it should have occurred, the President developed and implemented the idea that coping with the virus was a problem for the individual states and not something the President or Congress should try to control. To try to shift the blame onto 50 state governors, 3,300 county leaders, and many tens of thousands of mayors and city managers. 24. As part of this new approach, the U.S. President kept suggesting to the nation, repeated by the media, that a vaccine was coming by the end of the year, that businesses and churches would open up shortly, and this made it more difficult to bring the virus under control. 25. In contrast, South Korea, as a national effort, determined that testing was needed to determine who was spreading the virus, and that all persons in contact with an infected person or carrier needed to be reached and quarantined and treated so that new infections from this source would end. 26. In South Korea, technology of the cell phone and credit card gave enough information and enabled identification of persons exposed to the carrier, and a sufficient number of contact persons were trained and used to find and test, if necessary, and quarantine the persons exposed. The U.S. lags very far behind because it has no national testing policy and doesn't know who is infected or becoming infected as the virus spreads throughout the tens of thousands of communities, jails, nursing homes, churches, schools, meatpacking companies, and other businesses. 27. In just 3 months, South Korea brought its new cases down to 0, and a total of 269 deaths from inception to the present. Meanwhile, the U.S., with a population only 6 times that of South Korea, has 20,000 new cases each day and climbing, and has close to 100,000 deaths, and expected to reach 100,000 or 200, 300,000, or perhaps a million or two more. The Spanish flu pandemic of 1918-1919 had 40 to 50 million worldwide deaths. And during the past 21 years and continuing, 25 to 35 million worldwide deaths from HIV/AIDS, with no cure or vaccine having been found so far, but with antiretroviral treatment to control the virus. There does not appear today to be any antiretroviral treatment to control the coronavirus. In summary, I have tried to bring together the information one needs to try to understand why South Korea solved the pandemic problem in 1 to 4 months, and the U.S. has a new case curve that seems to be heading almost straight up. The South Korea president has a huge background of working in politics and took immediate national control and made the right decisions with 800,000 government employees available to him. Whereas President Trump, with no political background and no business experience other than running a family licensing business and avoiding debt through numerous bankruptcies, did not listen to his experts and could not or would not read what they were saying, so that he did not use the awesome power of the nation to try to control the coronavirus. And when he saw the mounting death toll, he saw that it was too late for him, in his desire to get reelected, to have a national involvement, and stated instead that the problem had to be solved by state and local governments. Of course, they could not create the money necessary to do the job. Also, it appears that a national approach would have interfered with the administration's officials and friends who could and did make money, usually the taxpayers' money, off the pandemic. Well, I just wanted you to reflect upon these differences, which is why in South Korea, where I have never been, by the way, I would be walking around more worried about getting hit by a motor scooter instead of where I am right now in my 72nd day of quarantine.